Hello, everyone, and welcome to the Toronto General and Western Hospital Foundation virtual Q&A. We hope you are staying safe and well and taking care of each other during the COVID-19 pandemic. I'm Christian Cote, host of the UHN podcast, Behind the Breakthrough, and we're glad you could join us. I'm grateful to you, our family of supporters who've been so generous throughout this challenging time. So a big thank you on behalf of the foundation and all of UHN. This episode, we're talking about the concerns over the rising case count of COVID-19 in Ontario, where it's happening, and how best to protect ourselves through this period. Plus, we'll be taking your questions on Slido later in the program. With us today, we're so pleased to have, as always, the expertise of Dr. Alon Vaisman, UHN Infection Control Physician. Welcome to the program, Dr. Vaisman.
Thank you for having me.
Let's get right to it. And clearly, most striking about Ontario's first month in the second wave of the pandemic is the huge rise in daily case counts. And yet we haven't seen a surge in patients in hospital ICUs. What's your sense of what's behind that, Dr. Vaisman?
Yeah, that's a very important observation. Unlike other parts of the world where they've seen a concordant rise in ICU admissions or hospital admissions as case counts rise in the community, we haven't quite seen that yet in Ontario. One explanation that some people are hypothesizing is the virus, for some reason or another, is less virulent this time. In other words, it's less aggressive. But the second most likely explanation that most people would support is that it's only a matter of time that we start to see a rise in those cases. So initially, we see a lot of young people being affected by the virus in early to late September. It's only a matter of time before we start seeing more and more cases among elderly people. And in fact, it is occurring more often and perhaps nearly as often as it did in the past in long-term care facilities. So I think that observation of the hospitalizations and the ICU admissions, we may start to see a quite significant rise in the near future in the next few weeks.
Okay, it was also, though, interesting to see data in the past week or so breaking down where the rise in cases is occurring in terms of environments. Some of the leading environments being grocery and retail and schools and daycares. How much of a concern is that to you when you see those numbers?
It's a reflection of the overall rise in cases in the community. So we hypothesized, or many public health officials hypothesized in August and September, that the rise in cases was due to people not adhering to measures in their private homes or gatherings, attending large functions, not following measures there. So it's only a matter of time before those cases start to make their way to other settings. So you mentioned retail centers or stores. It's only a matter of time before it reaches those areas where frontline people who are working in those places are going to be affected. The same is true for schools as well. Although we saw very low cases in schools in the very beginning, little clusters, little outbreaks here, the number of cases in the schools is very slowly rising now. And that's a reflection of the community incidents, people introducing it from the community, parents, children, teachers.
And, this is such a complicated issue, the schools and daycares, especially for parents. We've heard of some schools with outbreaks where staff and students refuse to attend. I understand in Toronto, 7,500 elementary school students switched from in-person learning to at home. That was during the Thanksgiving weekend, which was the first chance to do so. And yet some 3,000 students went the other way. They're going back to school. So obviously, it's a reflection of how confusing this must be for parents with regard to what's safe. Do you have any advice for parents out there with school-aged children?
It's a very challenging question. It's up to every individual to make that risk assessment for them. I think what's different now compared to when the decision was initially made in September is that now parents have a little bit more data to work off of. They see how schools have functioned over the last 2 months. They see how often cases have come up and how the schools have responded. So a parent might look at their own personal situation, the presence of grandparents, people who are ill. They will also look at the school that their child is attending and look at how the school has handled cases. Have there been lots of cases? And I think based on all that information, parents will decide for themselves whether it's worthwhile to continue having their kids in school or not. And of course, the other side of it is the important benefit of attending school. There's the socialization, education aspect. So it's not an easy decision for any parent to make, but I think the important message is for every person to make that personalized decision for themselves, one that's tailored to their own situation.
And this week, we also saw the province unveil a new strategy in terms of fighting the virus, bringing it under control with regard to restrictions to help guide their decision making. It's based on 5 color-coded levels. Do you mind, Dr. Vaisman, could you walk us through each category and what it means to us?
The basic concept behind this new stratification method is to try to understand which triggers will result in which kinds of restrictions in society. So one example might be what we thought of previously as stage 2. Moving into that stage, if we see a certain amount of cases in the community, the triggers that they have so far come up with are things like positivity of cases based on the testing. So for example, in that example, I gave 10% of cases being positive based on provincial testing or regional testing would result in certain restrictions. It also is based on the number of total cases that are coming out from that day. So as opposed to the previous approach, which wasn't as transparent, now we have a more transparent approach. The question now is whether there is agreement about whether the triggers are good or bad. In other words, whether they are too conservative or too liberal when it comes to whether you should start closing things down or not. And I think there's a lot of debate over that. It's going to be challenging to figure out the right answer, but at least this is a step towards transparency. Now everyone understands what is the thought process from the government when they are deciding on making these decisions, moving through these colors of lower to higher restrictions.
Okay, let's move to the big picture for a second, because Europe has been heating up a lot in terms of cases. Belgium, the hospital healthcare system there, I believe, is in surge and being overwhelmed. And it's often been said that Canada can expect what's happening in Europe to reach here a few weeks or several weeks later. So given the lessons, or what lessons do you think we should be taking from what's happening in Europe now in terms of what could be coming here?
Yeah, among the other things, the 2 important things that need to be learned from other countries is their ability to test broadly, and secondly, their ability to contact trace. Contact tracing is one of the most important aspects of being able to control a pandemic. That's what we've learned so far from the countries who have successfully managed COVID, including those in Southeast Asia, Australia, China. So in this case, when we're looking at Europe, their inability in some instances to not be able to trace cases has led to subsequent cases and subsequent explosion of the numbers. Here in Canada, there has been so far relatively successful examples of contact tracing. However, as we all know, in specific example of Toronto, several weeks ago, they weren't able to continue with contact tracing. And so that itself is one explanation why we are seeing a rise in cases. So the better ability you have to be able to trace cases, the more likely you're able to keep things under control. And to prevent Canada from going the same direction that Europe has, that's going to be one of the most important things. And of course, the other important aspect is easy access to testing. Those people who need to be tested should be able to access tests in a short interval and get the result back in a short interval as well.
You mentioned places like Australia and Asia in terms of their success at keeping the virus under control, hammering away at the virus case count. Is there, besides a really sophisticated contact tracing and testing system, is there anything else that they're doing that we could take lessons from?
One of the things we know, of course, worked in the very beginning in the case of China and in other cases in Southeast Asia was a very severe lockdown. In the case of Australia, that was an example where how successful that can be, where areas that were very hard hit over 2 months, approximately during the summertime, a lockdown was very successful in being able to bring the cases down. That is, of course, an important lesson to learn that is very effective, but that's something you don't want to use immediately. You want to have that in your back pocket, so to speak. So I think people need to recognize that that's kind of a backup measure if necessary, but it is effective and it is there. One of their also strengths that they have in those countries that we haven't talked about yet is very good public health messaging, is being able to communicate things very well to the public and have them on board and on your side when it comes to adhering to these policies. That is going to go a long way in preventing people from opposing the ideas of masking or keeping distance, those kinds of things which are so important to controlling the pandemic.
All right, let's move into some details in terms of safety and protecting ourselves again. Canada's Chief Public Health Officer is now recommending if we use non-medical masks that we actually have three layers of masks. What's the science behind that now?
The general concept behind it is to try to improve the benefit of wearing the mask. So unlike surgical or procedure masks, which we use routinely in hospital or clinic settings, the cloth masks don't have any routine testing or standards that we can use to verify their efficacy. So instead, we just rely on the materials they're made of. One additional way you can try to make sure, or at least get to a closer point where you're more confident of the efficacy of the mask, is to ask Canadians to use a 3-year layered mask. So that's just kind of like a rough way for people to understand that that is a more effective mask than, say, taking a bandana and putting it over your face, or just a scarf. So a 3-layer mask implies that this has been produced, it's been thought about, somebody has put it together, and it's likely going to be more effective than the other homemade solutions that people have come up with. Now that we're this far into the pandemic, the other thing to recognize is that these are more widely available than they were. If this recommendation had come out in April, say, there wasn't much access to these kinds of masks, these kind of cloth masks, so it wouldn't have been very helpful to say it, and people would have felt anxious. But now there's so many places where you can access these kinds of masks, so it makes sense to try to increase a little bit the efficacy of the masks used in public.
So just to drill down a bit, Dr. Vaisman, there now is actually a manufactured 3-layer mask that we could buy, say, at a Home Depot, or what are you looking for, and where would we find them? Do you know?
Yeah, there's some people who can, a lot of people are making them at home. You can make cloth masks. You can make a slot available for inserting a filter. And there's also public manufacturers that you can order online from, for example, that can provide these 3-layer masks, where you can also follow the instructions carefully in terms of purchasing them, taking care of them, washing them, removing the filters, inserting new ones, those kinds of things. So now these things are more readily available in places like online, and some stores as well might carry them.
All right. The issue of aerosol generating particles, that comes up, I think, probably every live stream we do. I understand Health Canada has revisited its guidelines a couple of weeks ago. So what's the latest when it comes to the spread of COVID from coughing, sneezing, laughing, shouting, singing?
Effectively, the science hasn't changed. The Health Canada changes are now in line with some other documents like the WHO, which acknowledge the importance of ventilation in some settings. The important thing that what's not in there is to say that airborne transmission is not the predominant method of transmission. So the Health Canada, the public health agency, still says droplet is the predominant mode of transmission, not the primary, and airborne is not the primary mode of transmission. What that effectively means for most Canadians is that there's no need to change what they're currently doing in terms of masking and keeping distance. What that means in hospitals also, it means that there's no effective change to what we're doing in the hospital setting either, when we're talking about healthcare workers looking after patients with COVID, or patients who are coming in with COVID wearing masks, for example. So that's an important, it's important what also was not changed in that document for people to realize. I think more and more people are understanding, just like with other respiratory viruses, that proper ventilation is important, and that you're more likely to have airborne transmission in very poorly ventilated settings. So whereas airborne transmission makes up a tiny amount of transmission events in the general population and in most healthcare settings, in settings where there is very poorly ventilated areas, you are more likely to have airborne transmission, or what do we think, or what we might think of as airborne transmission. And this is, again, a very small proportion of cases.
Okay. So one other aspect is the infectivity period. From the very beginning, we're always saying 2 weeks, 2 weeks, 2 weeks. That's also been revised recently, I understand. Can you walk us through the latest on that front?
So as of about 2 months ago, the Public Health Agency of Canada and also the public health authorities here in Ontario and in Toronto have changed their period of isolation for somebody who has confirmed to have COVID. So previously we would isolate those individuals for 14 days, but now we understand that the likelihood of infectivity past 10 days is very low if you have mild or moderate illness. In other words, if you're an individual who's staying at home and has been diagnosed with COVID, or is sick enough to go to hospital but not be admitted to the intensive care unit, 10 days is the longest when you will be infective, or I should say communicable. So another person could get the virus from you. Past that point, you'll be released from isolation. For people who have immune compromise or who have a very severe form of COVID and, for example, need to be admitted to the intensive care unit, those people would be isolated for 20 days. But the vast majority of people who have COVID will only need to be isolated for 10 days, as opposed to the previous 14 days, which was the period that we used since the beginning of the pandemic.
One thing I find interesting, and I just wanted to get your take on this, is, as we all try to somehow go about our daily lives, how would you advise people who want, their kids to continue going to recreational dance, or, you want to keep going to your beer league hockey game? What's your advice in this instance?
So firstly, I'd say to everyone to follow the recommendations of the local, the municipal, and the provincial health boards or bodies. If they are instructing that such and such activity is not to be done or not to be done in such a way, that's the first thing I'd say, is to follow their recommendations. The second thing is that each of those examples you gave, they all have various risk categories. There's going to be some instances where, for example, playing hockey outdoors on a skating rink, it's not going to be too much of a risk, especially if you're able to minimize contact between individuals, if you're able to wear a mask. There is going to be some associated risk, but you can try to minimize it. Whereas playing indoors might be higher risk. Doing certain sports indoors as well, having high contact with one another. For example, if you're playing basketball, that's going to be higher risk than, say, if you're playing tennis. So each of those examples, each of those activities, whatever hobbies people may have, first of all, check with the authorities, and second of all, think carefully. But
I wonder if
whether it can be done in a more aware those aspects.
I don't know if it's on my end or your end, Dr. Vaisman. I had a bit of internet breakup there, but
sorry, I think there's a disconnect.
that's okay. That's all right. I just want to
sorry about that.
Not your fault. A quick reminder to our viewers, very quickly, we're taking your questions on Slido for Dr. Vaisman a little bit later in the show. So please go to Slido and put your questions in. Dr. Vaisman, over the last few weeks, there's been a sort of a public feud of sorts amongst healthcare experts over how to fight coronavirus in the second wave. There was the publication of the Great Barrington Declaration, and that was followed by the John Snow Memorandum. Do you mind summarizing those statements, and what do you make of them?
Basically, the debate, or what's been labeled as a debate between various people, some which are experts in public health, although they are a minority, is the position that the measures that have been taken so far across the world to try to reduce the spread of the virus have been excessive in some way, and that they are either not effective or not necessary, and that they have caused a significant amount of harm, both economic, psychological, and also health harms, and that it's not necessary to control the pandemic. Whereas the opposing side, the majority position that many public health experts would take, is that such measures that we've been taking, the response that most countries have taken, for example, that was taken in Canada approaching the virus, is the right one, is the more effective one, which is to say that restrictions in public activities are going to lead to less transmission of the virus and overall have an overall beneficial effect on the economy, on people's lives, on people's health. So this kind of discussion has been going on in the public forum. The general position most public health experts here in Canada is that these restrictions, and in some instances complete lockdowns, are necessary to avoid some very important outcomes. Of course, first, the illness and death of people, and secondly, not having to overload hospitals. That's one of the most important things here, is not overloading hospitals so that people can receive care, not just for COVID, but for other things. And that's the basic idea behind these discussions.
Are they helpful at all to, I don't know, guiding public health policy? I mean, because they certainly seem, I find people I talk to kind of, it confuses them to hear sort of feuding public health experts.
Yeah, it's a very interesting question. I think it speaks to two different kind of discussions. There's that discussion between experts in the field, among the, talking about specifics about science, methodology, numbers. And then there's a discussion between public health experts and the public. And people should try to distinguish the two, because even if there is debate among experts about this or that topic, that doesn't necessarily mean that the overall message that the public health experts are giving to the public is wrong or inaccurate or inconsistent. There is always going to be, and for good reason, debate among scientists and public health experts. That's how you figure out what the right thing is to do, is to debate. If there is dogma, then you're more likely to make mistakes. You're more likely to not be able to adapt or be flexible when new things arise. But that's very different from the messages that come out to the public. So people should expect, in not just public health, not just with COVID, but with all fields, matters of science, there should be some discussion. But they should try to recognize the overwhelming or the prevailing opinions of the public health experts as likely to be the correct ones at this time.
All right, last question from me. I'm curious your take on, the fact that we're all kind of struggling through this, like we're afraid and fatigued with having to be safe, and it's a daily grind. Do you think, as communicators, and I'm not putting this on you, but us as communicators in the health field, do you think we've done enough to help the public understand just how long we're going to be living with this virus, and would that help them cope better?
That's a really great question. I think it's very important to be as honest as you can with the public. The idea of trying to sugarcoat things for their own good, I think that's not helpful. And I think whatever we know, whatever we have our best estimates, we should try to provide that. That's not to say that we should be very precise, say on this month or on this day we expect this, but providing some kind of guidance to the public, I think would be very helpful. So as you said, understanding how long this is going to be, I think that message is very slowly coming out, and I think it would be beneficial if we heard more of that. For people like politicians, for example, to say things like, this is something you need to get used to, that even if a vaccine comes out, there's still going to be some changes that are going to be required. There's still some sectors of the economy that are not going to recover as quickly, or perhaps not at all. And I think the sooner people hear that, the sooner people understand that, the better people can adapt their lives accordingly and make choices for themselves. And now we are starting to get that. I mean, in the beginning, it may have sounded like a vaccine was going to be the silver bullet, but now we're getting more and more messaging that it's not necessarily going to be, even if it is very effective. And as to whether we've done a good job, I'm not sure, but we could always do better in that field. Communication is always that kind of thing where you could always do more, you could always do better. And so I think as we go into the winter months, it's going to be a very important message for people to understand.
All right. Well, you keep me honest, I'll keep you honest, and we'll keep trying to get that message across too. That's enough of me. Let's get to audience questions out there that have been coming in on Slido. Very busy day today. A lot of interest in your take, Dr. Vaisman. First question, what are the risks of taking public transportation, and what are best practices to protect oneself? What are the incidences of people contracting COVID through public transportation?
It's a good question. As far as we know, the likelihood of transmission is not high if appropriate measures are taken. So there were some cities across the world when COVID was spreading where measures were not taken, and those are very big hotspots for transmission. People were packed into trains or subway cars, for example, getting to work, getting home. But in Toronto, for example, and in most cities in Canada, a lot of measures have been taken to reduce transmission. So the best practices are similar to what you see, for example, at TTC: universal masking, distancing between individuals, and washing hands. Those are the most important things you could do when you're on a bus or on a subway, for example. So, things are well marked now. People should be following them to the best ability. Masks are being handed out to people who don't have masks. Those are all the important things you can do to try to reduce your risk of picking up the virus.
All right, next question. And I'm not sure if you're answerable for this, Dr. Vaisman. Why do we keep hearing that groups of doctors are questioning that this is not a real pandemic and this situation is a hoax? Plus, the flu kills just the same amount of people as this virus, and face mask does not prevent the spread of the virus and should not be made mandatory.
So I think what we should distinguish in that question is between public health officials who have good intentions in trying to understand the pandemic, trying to raise honest questions about which restrictions are necessary and which ones are not, versus deliberate misinformation where people are trying to convince others that this is a hoax and that none of this stuff is necessary. I think there's an important distinction there. There's some public health experts who honestly want to have a discussion about things, whereas others just simply want to mislead other individuals. As for the question about the virus being as deadly as the flu, even if you take the numbers being identical, let's say we had 2 flus, that would still be extremely challenging situation. You'd still have a lot of deaths, and you would still have a huge burden on the healthcare system. So you would still take this pandemic just as seriously. But because this virus is new, we know that this is not just like the flu. This is actually going to be deadlier than the flu. So I think it's important to realize that this is different from everything we've experienced in the past. And that whenever you're looking at these sources, people having discussions in the public, similar to your question earlier, a good tip is to try to verify things, try to look for other points of information, try to look at where the source of that information is coming from. Is there someone who has experience in the field, who has some respect for or credibility from other experts? Or is this somebody who has, absolutely no credibility, has never been in part of these kinds of discussions? It's important to try to get information from reliable sources as best as possible.
That rate, am I correct in that the death rate when it comes to COVID compared to the flu is about 5 times greater? Is that the right ballpark?
That number will fluctuate. Some estimates will be somewhere between 10 and 30. Some will be lower. One of the challenges with flu that we don't have, or we had less with COVID, is that we don't test as often for flu in the past as we are testing for COVID now. And also we do antibody studies where we look at who has had COVID in the past. So those factors can sometimes inflate or deflate the mortality associated with COVID. So it's not surprising that you might see a factor like 5 being published in the literature and then a different number being published elsewhere. This is just going to be evolving over the next few months or years.
Okay, next question. Assuming we have a vaccine within the first 3 months of 2021, what percentage of the population needs to be vaccinated in order to get back to normal? And what is the projected timeline to immunize to that level for Canada and for the rest of the world?
So as to the question about what proportion of people need to be vaccinated to get back to normal, the getting back to normal depends on the risk thresholds that people have in each nation or each jurisdiction. Some areas are not going to feel comfortable with even a small proportion of people having COVID with possibility of being exposed and having transmission events. So some events that you might have attended in the past, like going to large gatherings in bars or concerts or sports venues, that may never go back to normal, or it may only go back to normal in certain jurisdictions. So it's hard to know what proportion that will be. We do know with some other viruses like measles that it's upwards of 90%, for example. You would need to be vaccinated or immunized to have what's termed herd immunity, or a sufficient amount of herd immunity that you would protect those individuals who cannot be vaccinated from getting the virus. So the timeline for this immunization, again, it's still up in the air. We've heard so many different numbers now, anywhere between the spring all the way now to the summer. It seems like spring would be fairly optimistic as a time where vaccination would start. And then it would probably take several months after that for you to have a very broad vaccination program across all of Canada.
Right. All right, question from Lil. I see some people wearing masks outside on my walks in the neighborhood. Is this recommended to reduce risk in case another not wearing a mask gets too close by accident?
Yeah, it's not entirely necessary that you wear a mask when you're outside. It's recommended when you do that only if there is an expectation that you won't be able to distance from others, or that you're in an area that's very tight. So some people feel more comfortable because things happen unexpectedly. You might bump into someone, you might enter an area that's very crowded, but it's not necessary in most times. Most people will be walking alone down the street. There's no risk right there. You don't need to wear a mask. Some people will put on mask in preparation of entering somewhere. So let's say you wash your hands, you put on your mask, now you're walking down the street, you're going into the subway, for example, versus not wanting to put on the mask while you're on the street because you haven't just washed your hands. So it's about people's preferences, but if you can assure that you're not going to be close to another individual in the outdoors, you don't necessarily need to wear a mask.
Okay. Next up, how safe is eating in a restaurant? Some have plastic partitions. Is this better or worse? And what about restaurants offering outdoor plastic bubbles to eat in?
So the question of how safe it is to eat at a restaurant depends on how much COVID is in the community. So currently, with the amount of COVID that we have in Toronto, for example, or Peel region, it probably won't be very safe to be in restaurants indoors eating because of the amount of COVID, because of the likelihood that there's going to be another individual there who's likely to transmit to you. When cases start to fall, that'll change. Hopefully that'll be the case in the next few weeks or maybe even a few months once this peak hopefully falls. At that time, what you'd want to do is do the measures that we've talked about in the past, including hand washing and masking wherever possible. The plastic partitions that people might put in, they are effective as long as they're used properly. But the presence of people inside the or alone is a little risky. Areas you just need to make sure that you have answers, but if it's fully used and then not properly ventilated, you essentially just structure. So you want to just make sure that that's the case if you're going outside, if you're eating one of these plastic bubbles.
Next from Stacia Rubinovich, is there any way to socialize safely with another couple indoors during the winter months? Is keeping 6 or even more feet apart sufficient, or is the risk of spread through aerosols just too high? How much time in the same room is problematic? That's a great question.
And we don't know exactly the answer to the question of how much time. There's been rough estimates of 15 minutes being placed as a period that you don't want to be unprotected with somebody. But the virus can transmit if you're less than 15 minutes of exposure. And the 15 minutes goes along with being less than 6 feet apart and unmasked as well. When it comes to whether or not you should be indoors socializing with people, that again goes back to the question of what's going on in the community. If there's high amounts of cases like we're seeing right now, then doing this is not a good idea. Right now, there's so much COVID, there's record numbers still in Toronto and across the province that it's still a very risky thing to do. When it comes to, let's say, Christmas, that'll be a different discussion. It'll be depending on what's going on in the community. So I'd say for now is to take the advice of Dr. Davila, who made a comment last month that if it's not your home, don't go inside it. You know, there's no amount of time that will be safe. You should only do that if it's absolutely necessary, if it's some sort of emergency or important for safety, for example.
It's really tough for everyone, isn't it? It's just, we have to have this mindset more and more of this is short-term pain, hopefully, but we have to stick to this.
Right.
Next, is it necessary to disinfect packages that you bring into your home? Example, food deliveries from Amazon, etc.
No, generally speaking, it's not necessary to disinfect the package. All you have to do is wash your hands. That's all you got to do. And most importantly, wash your hands before you eat or before you're touching your face.
Right.
The virus isn't likely to survive very long on these surfaces. And even if it does, you can mitigate that risk by just washing hands. It's very easy to kill the virus on your hands. You just need to wash it. Even alcohol is sufficient. The alcohol rub that we use in hospitals, for example, or in public, that's sufficient to kill the virus. So you don't need to disinfect these surfaces. Just wash your hands.
This next question almost feels existential. What about vitamin D?
It's great. Specifically for COVID, we don't have any evidence that it improves COVID outcomes. There's been many negative trials that have been performed looking at whether it has any preventative effect or whether it can reduce the length of illness, but there hasn't been any evidence to support a benefit when it comes to COVID. Of course, vitamin D has other health benefits related to bone health, and there's a lot of underuse of vitamin D for that reason. So if you're interested in taking vitamin D for your bone health, you speak to your physician about that. But for COVID specifically, it doesn't have any benefits as far as we know.
Okay, my friend lives in a basement apartment in a house. Is it possible for the virus to be communicated through the vents if the neighbor upstairs or their guests have the virus?
So this goes back to that hot button issue of aerosol transmission. And we can't say no, that's impossible. What I would say that is unlikely to have occurred. We haven't seen outbreaks of that nature in such a setting where there is patients or individuals who have COVID in one part of a house who transmit it to others through the vents, but I can't say that that's impossible. I would just say that it's very unlikely. One way that this individual may try to reduce their risk is by keeping windows open wherever possible. But of course, if it's wintertime, that's going to be more challenging. But I would say overall, it's not a high risk that that'll occur.
And you wouldn't encourage them to like tape their vents or cover their vents?
No, that's not necessary. But also you need your vents for either central heating or central cooling. So you have to think about doing that very carefully. But I'd say that that's not necessary for this purpose.
Okay. Next question. Is it safe to be with someone with COVID-19 who is symptom-free if both people wear masks but travel together in the front seats of a car?
So if somebody has COVID and is asymptomatic, their likelihood of transmission in most cases is likely less than somebody who has a high degree of symptoms. However, there is still a risk of transmission. So you would still want to minimize your exposure to that individual as much as possible. The only instances where you should be in the same car as them is if there's some kind of safety issue or some kind of emergency where you need to transport them. Otherwise, it wouldn't be advisable to sit in the same car with them, especially not in the front seat together. If absolutely necessary, for example, cab drivers have driven patients who back and forth to assessment centers, for example. The cab driver wears a mask, the windows are rolled down, the person who's sitting in the back also should have a mask on, and that will reduce the likelihood of transmission. They shouldn't be sitting next to each other if you absolutely have to get into a car for whatever reason.
Okay. Next question. As the number of people who have been infected and recovered from COVID grows, there seems to be a lot of confusion regarding how long the antibodies to the virus may last. We need clear communication so people do not assume they have immunity and can behave differently, results in more risk.
So we don't have the answer to that. We have documented, well, in the world, there have been documented cases of reinfection of COVID. That is so far our best evidence about how long immunity may last. There are, all the data around antibodies is indirect evidence of this. The shortest known case where a person reacquired COVID was 6 weeks. That is only a single case, and there's only been a handful of reinfections in general documented across the world. So if you wanted to be absolutely as conservative as possible, you would say 6 weeks is the minimum, and then after that you can be transmitting again. But I would say for most people, the average person who, let's say, have had COVID in the past, it's still unlikely that you'll acquire it in the next few months, but you should be taking the same approach to safety as if you didn't have COVID. And there's a few reasons for that. One is that you want to set an example for other people around you. If you're on the subway or in the public or at work, you want to be able to do all those things because you don't want others to start not adhering to the principles, washing hands, wearing a mask, keeping distance. The second thing is that even if you happen to be immune to COVID, you're not immune to the other respiratory viruses, which are now circulating starting in the fall and into the winter season. So you still want to protect yourself against flu and other respiratory viruses. That's still very, very important. So you should still adhere to those practices. You yourself will never know how long you're immune to COVID. And until we have the sciences better, smoothed out, you should still maintain practices, even if you have had COVID in the past.
All right. Next question. Can a COVID saliva test be developed, created like a home pregnancy test?
So the current rapid tests that people can be doing are the nasopharyngeal swabs, and there are saliva tests, but the nasopharyngeal swabs are the ones that are been approved in Canada to be done within 15 minutes. It can be done at home. Those kinds of tests, they do require a little bit of training to be able to do. Eventually, these kinds of tests will be more available, including saliva tests, will be more readily available in even home settings. The question that will be is how reliable are they? Are they very sensitive? Are they very specific? Are people going to be able to report their results to public health because it's important for contact tracing reasons that we know about all the cases of COVID? And also, how is this going to change people's behavior? So it may seem like a great idea to just broadly deliver these tests everywhere. And in general, it could very well be, but there has to be a lot of education around that. So if there is a saliva test that's rapid that can be done at home, people need to understand the limitations of how to use it.
Absolutely. My understanding is there's still a lot of false negatives, and there's still it's not great in terms of its positivity rate. So you want the gold standard if you have concerns, and the gold standard being the nasal swab, right?
That's right.
Please talk about how, when we are out, to safely remove and store a mask without touching the outside, which is where COVID and other germs would be. Can you do that without a mask, Dr. Vaisman?
I don't have one on me right now.
All right.
But basically what you'd want to do is first step is to wash your hands. And then when you're removing the masks, don't touch the front part that's touching your nose or mouth. Always touch the straps first. So you can either use your pinky finger or one of your other fingers to wrap your finger around the strap, pull it off down and away from yourself, and then place the mask somewhere that is dry and non-contaminated. So even on a surface of a desk at your home would be appropriate, or on a paper towel, or in a clean bag that has not been yet used. If you want to put on that mask again, you'd follow the similar steps. You would wash your hands first. You would carefully take the mask out. You would hold the mask by its straps, not touching the front part, the cloth part that's touching your nose and mouth. And then you would bring it up to your face again. And then after you wrapped it around your ears, you would adjust the nasal bridge, make sure it's smoothed out and as tight as possible around your nasal bridge, and then wash your hands again. So wash your hands before and after touching your mask or touching your face.
And I know we've talked about this before, but good to remind people, the cloth mask, the non-surgical mask, how often would you wash those?
It's a good question. Generally speaking, if you've been wearing your cloth mask throughout the day, it's a good idea to wash it once a day. So when you arrive at home, if you're, let's say, at work or you've worn it on the subway, it's generally a good idea to wash it once a day. It's not always going to be the case if you've used it very little for that day, if you've only worn it for 10 minutes, but for your average person, the average amount of use, that would be a rough guide to follow.
Next question. Here's a tough one. Do you expect COVID-19 to be around for at least 5 years?
Well, the number of infectious diseases that have been eliminated by humans can be counted on a hand. There's almost none. Only recently are we almost nearing elimination of polio. And then the other important one that we've eliminated, smallpox. So the answer to that question is very, very likely to be yes, COVID is going to be around. There haven't been any respiratory viruses that have been eliminated. And what I mean by eliminated means that we don't have any circulating virus at all in the community or anywhere in the world for that matter, that it would exist only in labs. So the answer is highly likely to be yes, COVID will be around. The question is whether it'll be like the flu where we vaccinate people yearly, or whether it'll be something like another virus that we just vaccinate once in your lifetime and then you're immunized to it. It's unclear what that'll be. So far, it's pointing towards the former, where you would need to have more than one vaccination, but we don't know the answer to that yet.
Just a quick programming note out there for everyone, especially for our producers and technical people. Given we have so many questions, and if you're okay, Dr. Vaisman, I'm hoping that we could maybe go closer to top of the hour so that we could get more of the audience questions in, if that's all right with everyone. From Helen, we are told to wash our hands when we come in, when we came in from outside. Now that the cold weather has started and you are wearing gloves, what is your recommendation?
The primary reason that you're washing your hands is to prevent contamination of your mouth and your nose and your eyes. So if you're coming into a space, into an indoor space, and you still have your gloves on, you would only need to wash your hands once the gloves come off and you're doing some kind of activity where you expect that to happen. But we also know that people touch their face without thinking about it. So the sooner that you do that, the better. So once you take your gloves off, now alcohol dispensers are more available around in public spaces. Just use the hand rub and now you're good to go. So if you really don't have access to that and you really don't know what to do, you can take your gloves off and then later on, before you're about to eat, for example, or wipe your nose or wipe your mouth, then wash your hands. That's the most important key step there.
Next question. Why is the testing so bad in Toronto? You have to wait in line several hours to get a test and then have to wait several days for results. That really discourages a lot of people from getting tested. People who may go to work or send kids to school and spread it all around.
Yeah, that's one of the cornerstones of having good pandemic control, is making sure that tests are accessible and you get turnaround times that are reasonable so that you can actually do contact tracing. For the question is, well, why is it this way? Why is it so bad? First of all, I'd say that it's variable across the city. There's some areas that are very good. The labs have been able to manage the volumes and been able to have very quick turnaround times. Then there's other areas, unfortunately, that haven't been able to do that. That's a very complicated question that would be best answered by the lab specialists, but it is one of the most important things that the province and the city is looking at to try to improve, or I should say that the hospitals are looking at to improve. Some of the choke points in the system is the accessibility of the assessment centers. And as we know, a few weeks ago in early October, that was switched over to appointment only. So that will lead to some limitations, people getting access to tests, but hopefully some of that has been reduced. Some of the bottlenecks there have been reduced and more slots have been opened up.
Absolutely. Absolutely. All right, next question. What are we learning about the incubation period for COVID-19? Specifically, do the elderly move more quickly from infection to symptoms than do young people? And if so, what is the average difference? Also, are asymptomatic infections common in the elderly, or are most known cases symptomatic?
So the average incubation period for the virus, as we think, is about 5 or 5.5 days. The time where you can acquire the virus, the time that you manifest symptoms is approximately that. But we also know a significant proportion of people are entirely asymptomatic. So about perhaps in some case series is a third of patients, a third to 40% approximately. It's unclear whether your incubation period depends on who you are. For example, if you have immunosuppression or if you're elderly, it's not necessarily the case that you'll have a shorter or a longer incubation period. It's also not necessarily the case that you'll be asymptomatic in your course of illness if you're elderly or not. Theoretically, some elderly people will not manifest the same symptoms of infection in general, and we know that's the case for many infections. They may not mount the same response in terms of fever, and that is also true for people who are immunosuppressed. But even if that is the case, we still use the same kind of guidance in terms of isolating people during their incubation period, even if immunosuppressed and elderly people are less likely to manifest symptoms. We still take the same level of caution.
Exactly. Okay, what outdoor activities do you think will be safe during the fall, winter, hiking, skiing, etc.?
Yeah, hiking and skiing, generally speaking, should be safe because there's activities that you can do without being anywhere near another individual. Skiing, of course, there's the indoor part of it, going inside to change or eat or drink, whatever. That's obviously going to be a problem, but the rest of the activities, fairly low risk. Hiking especially, or snowshoeing would be another example. Skating as well, if you're not coming close to other people on a skating rink. There'll be some skating rinks that'll be open in Toronto as well for people to do that. So it's not as wide and diverse as the options you have during the summertime, but there is a few things you can continue to do. And since we've never been in COVID during winter in Toronto, although we were at the very tail end of it in March, it'll be interesting to see how the public responds to that, not only how people respond, but also how the city and the province respond. And what I mean is making things more available to people. That's going to be very, very important. If people don't have options of what to do, they're going to resort to things that are less safe, like having gatherings at home. So hopefully a lot of those things will be opened up, made easier for people to access, so that people do have a lot more leisurely things they can do during the winter, because it will be a very challenging time for people.
Yeah. Next question from Owen. How many COVID patients are currently in Toronto General Hospital, and on what floor are they located? What precautions are being taken to isolate them from the rest of the hospital?
So our current COVID numbers, I don't recall what the actual number is for today, but it has been somewhere in the range of 15 to 30, or probably a little less than 20 over the last week or so. Yep. And in intensive care unit, a few additional patients as well. So the numbers at UHN, for whatever reason, looks like they're stable. They're not rising in the same way that they are rising across the province. At UHN, we do have COVID dedicated units that look after patients who have COVID on the general ward, and then they are looked after in the ICUs as well if they're sick and require that kind of level of care. Those patients are placed in single bed rooms, so there's no other individuals in that room, no other patients, and they're placed on what we call droplet and contact precautions, which means that anyone entering that room, healthcare workers or visitors, must wear the mask, the face shield, gloves, and gowns before entering, and then they remove that once they leave. They remove the glove and gown when they leave. So all of those things are unique to people on droplet and contact precautions. Thus, we separate those individuals so that they're not in contact with other patients who do not have COVID.
And if you're, for the person asking the question, if you are curious, this is all very transparent on the uhn.ca website. You can actually go and find out how many people are in ICU, and you can find out how many COVID patients there are in the Toronto General, Toronto Western, Princess Margaret hospitals, etc. So that's public information.
Yes.
What treatments are working to save the lives of those who get COVID-19 and end up in hospital?
So many therapies have been tried, and the two that have been proven to be successful at this stage, one of them is called dexamethasone. It's a steroid that has been long used for many years for a variety of conditions, for example, inflammatory conditions. And what it does is reduce the swelling or the inflammation inside the lungs and other parts of the body. So if COVID causes an inflammatory response, dexamethasone tries to decrease that response. And that has shown some benefit, especially in people who are sicker or require oxygen, some mortality benefit. In other words, it can save lives. The second medication is called remdesivir. That medication has been repurposed for this illness. It was previously used for other viral infections, or thought to be beneficial in other viral infections. And now it's thought to be beneficial, although not to the same extent as dexamethasone in patients who have COVID. Again, most beneficial among those who are ill. So the patients who do not require hospitalization, there have yet to be any therapies that have shown benefit in that group.
Next question. Some cities are now requiring fitness instructors to wear masks while teaching classes. What's the reason for this if no members are wearing masks? And what are the health risks of exercising with a mask on?
So when you're wearing a mask, you're thinking about whether the two reasons you are wearing a mask. If we go back to the first principles of this whole concept, is one is to protect yourself and one is to protect others. So in any kind of indoor setting, you'd want to mask as many people as possible, both to protect themselves and prevent transmission to other individuals. I can't speak to specific policies of which cities, of who they're allowing to wear masks and who not, but the general recommendation will be to mask as many people who can tolerate it. When you're exercising, it would be, again, advisable to wear a mask if you are indoors and in close proximity to other people. Of course, it may be difficult for some people to wear masks who are exercising. And so some things you could do to try to reduce that, or for example, if you need to take off your mask, would be to exercise on your own, exercise outside, exercise in a part of the gym that other people are not near you. But that would be generally speaking, masking would still remain an important intervention, even in exercise areas or gyms, for example. I'm not sure why in this example of the question, why the other members are not asked to wear masks. It may be a specific policy to that gym or to that city, but that would be the overall recommendation. Although I would guess that a lot of people wouldn't be wearing masks in these settings because it's difficult to tolerate.
Yeah, and you might, if you're sweating and it soaks the mask, it's probably reducing its effectiveness. Next question. My staff have asked if their children to study abroad come for Christmas, what quarantine rules apply to the students and the family members they are staying with? What is the best way to protect all?
As of this moment, the Canadian government still recommends or still requires people who are traveling abroad who return to Canada to quarantine for 14 days, which means that you are not to be with other people during that period. You're not, ideally not supposed to live with anyone else. So in a hotel, Airbnb, in a home on your own, whatever the case may be. After that 14-day period has elapsed, then you could interact with family just as you would previously. So that is the best way to protect people, because it eliminates the possibility that you're able to have the illness and then transmit the virus to other people. And I'm guessing that will be the likely recommendation come Christmas time. In 2 months' time, it's not likely that that will change. One reason is that there's still a lot of COVID across the world. And secondly, there's still a lot of COVID here in Canada.
I'm sure we'll have a lot to talk about in our next session in December for the holiday season. When going for a hospital medical appointment procedure, which type of mask should be worn and what other key safety precautions should be followed? Thank you.
So this is where the question you had earlier about the triple layer mask comes in. So whereas before there was a little bit more laxity around the kinds of masks, now the recommendation becomes a little bit more specific. And this would apply to the hospital as well. And in UHN, if you don't have a mask, we will give you a mask. Anyone who wants to come into the hospital and who has a medical appointment, has to be there for medical reasons, they will be given a mask. So nobody has to worry about that. You will be given a mask. In this case, it'll be a procedure mask or a surgical mask, so there's no concern about its efficacy. Once you're in UHN, wherever you're going, we have a lot of signs up to encourage people to maintain safe practice. This includes continuing to wear your mask, washing your hands, and maintaining distance with other people. And we maintain that across the board. If you're going to a clinic, keeping distance between other people in the waiting room. If you're in the clinic room, we wash the space after you've been there. We wash our hands before and after we see you. And that's also everywhere else. If you're having a surgery, for example, if you're having an imaging test done, those principles apply across the board. Everyone's on top of that.
Great. Do you have advice for musicians? What would be required for brass, trumpet, trombone, French horn to play safely together indoors?
That I haven't received that question before, so I don't know if I have a good answer for you. I doubt that masking the trombone has any effect or is a good idea.
Well, I guess there's aerosol perhaps possibly coming through these instruments.
Yeah, I suppose so. I've never really thought about that, or I'm not sure what the science is around whether aerosols are generated through instruments. I would guess that there's some risk of that, and the recommendation would be to try to first of all space out, and second of all, try to do it in a well-ventilated area, either in a large room or outside or in a garage where the door is open. But even then, I can't guarantee that there isn't some risk of transmission there. And then, of course, again, washing hands, not going when you're sick, those are all very important measures as well. So I'm afraid I don't have a very precise answer for that one.
Maybe it's a Lancet paper for you, Dr. Vaisman. Sorry, I knocked my mic. We're coming to the top of the hour. We probably have a couple more questions we can get in. What do you think about the merits of a public curfew, for example, as being implemented in England?
I think something like, I'm not a public health expert, but I would guess that something like that would be helpful if you've identified the nighttime activities to be one of the main transmission risks. So if you're seeing a lot of transmission coming from bars and restaurants and these evening events, then making a curfew may make sense. But this would have to be a fairly advanced thing you do. This would be something that you do as one of your last measures, because it is quite a significant intervention. This would be what we're talking about when we say lockdown. Like having a curfew is very invasive. So because there's lots of things people do after hours that are not going to be deemed dangerous from a COVID perspective. So I would think that first of all, it should be targeted towards the transmission risk. So if you're seeing transmission related to that, and secondly, it should be done after many other things have been exhausted.
Good point. How much of a risk is there to healthcare workers working in clinics and hospitals? What are the chances of them getting COVID-19? That's a very good question.
Yeah, it's a very important thing. That the number of what are the chances or the risk, we don't quite know exactly compared to the general population. That number is still fluctuating. There's some parts of the world where that number is higher than the average population. There's some parts where that's going to be similar to the general population. Earlier in the pandemic, there were times in April and May where a higher proportion of healthcare workers had COVID than the general population, but that number is likely to change. Interestingly, what we're seeing in healthcare workers now is more likely that they're picking up infections from the community than they are from hospital. Sometimes it's very hard to know whether a healthcare worker has picked up the virus from the hospital. The best thing we could try to do to protect healthcare workers is the various measures that we've talked about here today, the various things we've talked about. One of them was the precautions that we've spoken about, what droplet and contact precautions mean, and how to make sure you're protected when seeing a patient with COVID. So it's hard to know what that number is in terms of risk. Hopefully we'll have some more stable or more definitive answers the next few months about that. All
right. And we'll make this the last question. What makes COVID so infectious?
Yeah, there's a few things that we know that are really unfortunate that have caused such a widespread of the infection. One thing, of course, that it's novel. When a virus is novel, there's no immunity in the population, it's more likely to spread. The second thing is the pre-symptomatic transmission. So 2 days before you're symptomatic, your viral load is starting to rise. With flu, for example, we almost never see pre-symptomatic transmission. All the transmission occurs when the person has symptoms. So because people can transmit before they have symptoms, their behavior may not be concordant with what you would do if you did have symptoms. So in other words, what you would do to try to protect others. So that is a huge risk. So you only identify people after the fact, after a transmission may have already occurred. The third thing is that there's very commonly asymptomatic patients, people who have no symptoms, are well enough to travel, well enough to go to work, well enough to see family, who can transmit the virus. Because of that asymptomatic transmission, that people who may never even have symptoms at all throughout their course of illness, that adds another layer that makes it even harder to track the virus. Now you have disease that's going through the population, and sometimes you have no clue where it came from because some people don't even have any symptoms. Those three features, just kind of like as a superficial discussion, those three make it very challenging to manage the disease. On top of that, the 14-day incubation makes it even harder. The fact that you can have symptoms way out after you've been exposed. I mean, I can go on about this, but those are some of the key points that make this a hard pandemic to control.
That's a great answer. Thank you. And look, we always seem to plow through a whole bunch of questions and the hour goes by really quickly. It's gone by again. It's the end of our time today. And I want to thank all of you out there for joining us. And as always, Dr. Alon Vaisman, UHN Infection Control Physician, thank you so much for taking time out of your busy day to share your insights and expertise with us.
Thank you for having me. Sorry about the internet there.
Yeah, we'll get you a router or something for the next one. As always, this live stream will be available on the Foundation YouTube page. And another programming note, this is a self-plug. If you're into podcasts and looking for a new one to put into your queue, how about Behind the Breakthrough? It's all about the groundbreaking medical research and the people behind it at UHN. It goes on right here every day. So if you're looking for a new podcast, there's new episodes every Tuesday and Thursday now. Go to www.behindthebreakthrough.ca. And for anyone interested in donating supplies or support to our frontline workers, you can email COVID support, that's COVID support, all one word, at uhn.ca, and someone at the foundation would be glad to help you out. And as always, we love to leave you with the final message that if you are in any way able to donate, it's critical to the work we do, both in terms of research and supporting our frontline workers. So if you're able to give, we ask you to consider making a donation. Holidays are coming up. Maybe put a donation in someone's name. Visit www.tgwhf, that's tgwhf.ca/help now. Thanks for tuning in. Keep practicing physical distancing. Wash your hands often, as Dr. Vaisman says, and mask up. Stay safe, everyone.